Are you considering getting dental implants, and how do you know if that is the right option for you? There are many reasons why you should and should not get dental implants, and in this video I will kind of go through some of the uses for dental implants today, and we'll also play a little game called red light, green light that will help you understand whether you are a candidate for implants or not. Since graduating dental school, I have performed and restored thousands of dental implants. And in my office, I tackle some of the more complex patients with complex medical history. Find this information helpful? Please subscribe to the channel. It helps myself and my team create more content for you. So dental implants can be used for many different things in dentistry. The first one is a single tooth replacement. So if it's a front tooth or a back tooth, you can essentially replace that with a single implant. Then you can also use implants to replace multiple teeth or a bridge of teeth. Third is implants that are used to hold partials or dentures in place. We call them snap-in dentures. And then the last one is what we call a non-removable fixed arch. Basically, it's a arch of teeth that goes into the implants and stay put. Okay, red light. These are what we call contraindication, meaning that no implants. Okay, now in this video I'm not gonna go into full depth of the different list that would make this a red light, but I will go through some of the more common ones, 3 specifically, that I see on a regular basis. And before I get further into it, if there's anything in here or condition that you may have that I did not mention, please leave a comment below. I'd love to look into it and answer those questions for you if you are or not a candidate for implants. So the first one is a recent heart attack, or if you had heart surgery like a valve replacement. Okay, in this case we will not perform dental implant on you unless it's been at least 6 months since that surgery date and you've had no other issues. Okay, number 2, it's called intravenous bisphosphonate. What it is bone medication. Okay, in cases like this, if you place implants, there's a risk of what we call necrosis of the bone, which is not good because you would end up losing more bone than trying to preserve it with an actual implant. And the third is patients who are undergoing radiation or chemotherapy. The caveat to this one is that, for me at least, you want to wait 2 years from the end of your therapy to when you place the implant, given that you have no health issues along the way and you are relatively healthy otherwise. Okay, yellow light. This is what I call relative contraindication, meaning proceed with caution. This list is the most obvious for most people, and that is smoking or tobacco products. Number 2 is uncontrolled diabetes. Okay, type 2 specifically. If that is not medicated, is not controlled, there's a whole list of other things that can go wrong there. That's definitely a proceed with caution. Success rate is not as high with dental implants there, so keep that in mind. The third one is poor oral hygiene or periodontal disease. It's not sexy, but you have to brush your teeth, you have to floss them, you got to keep them healthy. Otherwise, if you put an implant in an unhealthy environment, the risk of implant failure is a little bit higher. Okay. Number 4 for me is dry mouth from medication. People are on tons of medication these days. The more medication you compound on top of each other, the higher the risk that the implant could fail. And then the last part for me, number 5, is a maintenance plan. Now, this is the most crucial for me. This is my big warning to my patients. If you are going to get a dental implant, for whatever you use it for, make sure you have a maintenance. They need to be checked regularly. If you don't do so, I have seen plenty of implants fail when they are not being watched regularly. So it's very, very important that you follow up with your dentist and your providers after you get the dental implant. Even years down the road, those need to be checked on a regular basis. Okay, if we can see problems early, we can take care of them, but if they go unseen, who knows what will happen. and I've seen plenty of them fail. Okay, now on to the green light. Remember, the yellow light, you can still get implants. Even in certain cases of red light, you can eventually get implants. For the green light, these are your home runs. What we're looking for is a healthy mouth. So good oral health is very, very important. Number two is adequate bone height and width. So the best way to determine this is, in our office, we take a CBCT. Basically, it gives a 3D dimension and allows us to look into the bone, and we can assess the quantity and quality of the bone there. The third is minimal health problems. You can have health conditions, but if they are well treated and under control, that's fine. And then the last is there are no real limit to the age in which you can get implants. I've placed implants in patients that are in their late 80s and early 90s. But as far as the age at which we can place them, at least for myself, for the men, I usually start at the age of 25. And for women, I usually start at the age of 21. Mainly because bone is still shifting and changing. You don't want to place an implant, and if you're still growing, that implant's going to be there, but the teeth are going to shift. So if you want that to be predictable, wait until the teeth are done moving, and then you can place the implant. Okay, now that you know a little bit more about dental implants, please stay tuned to the following videos, because I will make a little bit of a mini series of implants. But if there are any questions you guys may have concerning dental implants or just dental procedures in general, please leave them in the comment below. I'd love to answer them for you. And again, I want to say thank you to all those who are following me. I hope you've learned something. And until next time, take care.